and action. Jim had a question about ribs. Mechanism of injury is always important, especially when trying to figure out or reverse engineer what happened. When we know what happened, especially the history, usually a good clinician can figure out the trauma or the pathology, the problem. You always have to make sure that x-rays and MRIs back up the diagnosis, but once a good clinician can figure it out, might not need that stuff. So in Jim's case, the mechanism was coming up with a layup, coming back down, hitting the cushion sidewall, then having a 200-pound person kind of crush in. And that's usually the same injury as being checked into the boards in hockey. The plastic boards that everybody kind of taps when you're watching a hockey game. Well, hockey players skate along at very high speeds, high velocities, and collision into the sides. They usually have some body armor, but it doesn't always protect the shoulder. So what usually happens with hockey players is what I thought Jim was suffering from. It kind of has to do with ribs, but let me show you that. So this is somebody standing kind of like this, right? So here's the left shoulder, here's the ribs, sternum, cervical spine, and the other shoulder. So when you have an injury this way, usually what happens with a crush injury going into the boards is this little thing here called the acromion. It's supposed to be where the clavicle or collarbone attaches. Both of them are connected by ligaments. Well, they're held together by loose ligaments and supposed to be able to help this thing move up and down. Well, when the shoulder, when the clavicle's here and the shoulder has been pushed in by either high velocity, 200-pound hockey player or basketball player, or just enough velocity to be pushed in to an immovable object like a wall or a plastic board, well, what's going to lose is a ligament. What's going to happen is the clavicle will pop up, ligament usually pops down, and you have AC separation. AC separation, if you guys remember Luke Longley from the Bulls, he had a big bump here. That's an AC separation. I've had a lot of people get by with healing from an AC separation without surgery. Surgeons used to take this distal third of the clavicle off so that there wouldn't be any poking or grinding. Didn't really improve healing time, and it was an unnecessary surgery, so nowadays we're not even doing anything with it. But it does hurt. That's what I thought Jim had. But then his pain was kind of down here. So then I thought, okay, maybe it's a fractured clavicle or collarbone. Seemed okay. So I still think that it was more separation. He heard a pop when he hit the boards, or when he hit the back, the cushioned flat wall. There is also a clavicle that meets the sternum. And that junction is a tight junction. It's more of a fibrous junction. That can dislocate. I've seen it happen very few times. Mostly car accidents when the sternum gets pushed into a bag. So it could be that. If it's that, you can't really see it. But the reason I'm talking about the last possibility is always going to be a rib fracture. But it's hard to fracture a rib up here because the shoulder will usually take the impact. And you can't push the shoulder into the rib and have a rib fracture unless it's really high velocity, like getting hit in your car by getting hit by a truck. That's usually death because that kind of velocity your head's in the way too. However, between the three possibilities, there is one final one. I should say not between the three, but in addition, the fourth possibility is back here. So this is probably what's going to be the moneymaker here. The rib is like a bucket handle. In fact, rib works like this. If this is the chest cavity, usually the rib goes up and down. You take a deep breath, it moves up. Take a deep expiration or exhale, it moves down. So it works like that. Connected in the front to the sternum, and imaginary with this bucket, in the back to the cervical spine. So it just does that, right? So the connection to the front and the back have to be somewhat loose. Otherwise you wouldn't be able to hinge it up and down. So that's how they work. Inhale, exhale, inhale, exhale. The sternum is a tight junction. The connection between the rib and the vertebral bodies of the cervical spine, thoracic spine, that's down here, that's not such a tight junction. So there's usually muscles that surround that more so than the sternum. There's muscles that surround this thing, and a disc on top and disc on the bottom, but that's essentially it. Sometimes what I've seen happen is the rib, as it meets the vertebral body, whether it's a cervical or the thoracic, it's mostly thoracic. You can sometimes have a cervical spine in some people, but the rib will pop out. It'll sublux. A lot of my orthopedic surgeons don't believe that or don't follow that theory, but chiropractors, usually this is their forte. I've sent many patients that have been in motor vehicle accidents because of this kind of a sudden injury and back pain that just is not going away. Hey, listen, whether it's a ligament that's pulled as a true mechanism or this thing actually moves a little bit, a chiropractor is not going to hurt. Chiropractor will help. At the least, you have hands-on healing, massage, and muscles around here are spasmed. And Jim had a little bit of pain in the back. Most of the pain was here, but I still think the radiating pain to the backside could be that sublux. If it works, I get him to my chiropractor is in South Elgin, Dr. Getz. If Dr. Getz is able to fix this, usually within one manipulation, it's much better. The pain to the back is better. The pain that radiates around to the front is better. And hopefully it stays there. But the thing is, once those ligaments that hold this thing together, once they're stretched, it takes a little bit of time before they get their elasticity back down to being tight again. They will. But if it stays stretched for a long time, you'll never get the elasticity to rebound. Sometimes you'll feel a pop when it goes back in. So anti-inflammatories will always help. I mean, there's a lot of muscle spasm around this to stop any further damage. So muscle relaxers help. That's a prescription. You take it at night usually, or during the day if you have to, but it makes you really sleepy. Anti-inflammatories at the site, or topically, or by oral form, whether prescription or over the counter. Doesn't matter. They all work nicely. See my video, DrRic Tutorial NSAIDs, N-S-A-I-D-S, for ideas. Turmeric is a great anti-inflammatory. My favorite one, Gaia brand, was not approved by Consumer Lab as of lately. Doctor's Best is a nice turmeric. You always have to have turmeric, curcumin, plus black pepper if you're going to get it absorbed properly. Magnesium helps for the muscle spasm to relax it a little bit. Topical Panaway, topical magnesium spray. Sometimes Trameal, a homeopathic topical, will also help as well. Acupuncture works great for relaxing the area and allowing the subluxation, in theory, to come back in. All these things help. The reason for the radiating pain is that usually the nerves for the ribs originate from the back. So even though you have pain in the front, it's because the nerve that takes care of the front originates from the backside. So if you have an impingement here, a broken bone here, it'll always throw pain all the way around to the front. That's why sometimes when you have zoster, that's shingles, it'll follow the dermatome right around the rib area. That's the dermatome. That's the nerve territory. Finally, usually if it is a crack rib, they stay, even if it's two pieces that, like a clavicle sometimes, that break in half, there's a wrapping, like a condom, that covers the rib. And even if it's broken in two pieces, there's a saying in sports medicine, if you have two ends of a broken clavicle in one room, they'll eventually find each other. The wrapping is very tough, and it's hard to penetrate, but if the cracked ends are anywhere close to each other, they'll eventually get back together and form a big, ugly bone callus. Usually that's about 8 weeks on an x-ray, sometimes 12 weeks fully healed before you can go back into collision sports. I have boxers, when I used to work for USA Boxing, they didn't want to stop because that's their livelihood. They would just keep on boxing even with a broken rib, and it's not healthy to box with a broken rib. You might hurt for sure, but even if you break a broken rib, again, it stays within that tough capsule and doesn't go anywhere. It's rare that you'll see a rib go in and penetrate, after being broken, penetrate into the lung. You'll usually find them with high velocity injuries like motor vehicle accidents, gunshot, stuff like that. But I think the bullet will probably penetrate anything before the rib penetrates anything. So that is what usually happens when we consider fractures. Older folks, I sometimes will get them on myocalcin nasal spray. It's an osteoporosis nasal spray, but has a bone relieving property to it. Vitamin D has to be maximized on. And pain control is important because what most people do with a crack or a ligament sprain or a separated rib, what most people do is they splint the side that's injured. And what happens when you don't breathe in deeply on the side that's injured? Well, you won't have any pain, but this lung doesn't fill up. And so the likelihood of atelectasis and pneumonia is higher, and then you're screwed because then you got to cough the pneumonia out. Then every time you cough, it hurts the rib or the ligament or the subluxation. So all these things, pain control is important. Inflammation control is important. Muscle relaxant, whether it's prescription or herbal, is important. Maximizing on anti-inflammatory diet, very important.